Everybody. Good morning, everyone, and welcome to our special event, See the Sign, Say the Word, Delirium. My name is Kim Simpson. Before we start, I'm going to start with the land acknowledgement. We are gathering on traditional land sacred to many Indigenous nations. I would like to acknowledge the traditional territory of the Anishinaabe, which includes the Odawa, Ojibwe, and Potawatomi nations, collectively known as the Three Fires Confederacy, the Haudenosaunee and Wendat nations, and the presence of other First Nations, Métis, and Inuit residing in Simcoe, Muskoka territory. Most of us have come here as settlers, immigrants, or newcomers in this generation or generations past. We are all treaty people. As such, we commit to collaborating based on the foundational assumption that Indigenous peoples have the power, strength, and competency to develop culturally specific strategies for their communities. We are dedicated to honoring Indigenous self-determination, history, and culture, and are committed to moving forward in the spirit of reconciliation and respect with all First Nation, Métis, and Inuit people. Thank you for joining us to take action together for World Delirium Awareness Day. The information shared today is meant to support and empower you in making informed health choices. Our aim is to help you speak up when it matters most. Education complements, but does not replace personalized medical advice. The information presented today draws on trusted research, expert review, and freely available resources. This presentation was co-created with people who have lived experience as older adults and care partners. We work together to take best practice information and explain it in clear, plain language so it's more accessible and easier to apply in real life. Lauren Castle is a Community Partnerships and Education Coordinator with the Patient, Client, and Family Council based in Midland. The organization provides peer support, education, and advocacy for individuals experiencing mental health and addiction challenges. In her role, Lauren works closely with North Simcoe Muskoka Specialized Geriatric Services to ensure that clients and patients remain at the center of all conversations when delivering education, information, and system-level insights. Heather McDonald is an advanced practice clinician at North Simcoe Muskoka Specialized Geriatric Services, who is currently leading a project on reducing the risk of prolonged hospitalizations and delayed discharge for older adults. She is an occupational therapist by background and has worked for over 20 years in a variety of roles, including geriatric mental health and trauma neurosurgery at St. Michael's Hospital. Heather is an active volunteer in her community. Welcome, Lauren and Heather.
Thank you so much, Kim. I am happy to be here today to talk about delirium. Our objectives came from our most asked questions in our community presentations as we give education around North Simcoe Muskoka. So in this presentation, we'll explore what delirium looks like, why it happens, and how we can help prevent and manage it. We'll also direct you to some helpful resources, all in hopes that you will feel confident to speak up when it matters most. So what is delirium? Delirium is a sudden change in how someone thinks, acts, or understands what's happening to them. They might be confused, see things that aren't there, or seem quiet, withdrawn, or sleepy. They could also be anxious, restless, agitated, or angry. The key point here is that it is a sudden change from your baseline behavior. So delirium is more than just confusion. It's a medical emergency. When someone suddenly becomes disoriented, agitated, unusually sleepy, or their thinking changes quickly, it's a sign that something serious may be happening in the body. That's why anyone showing symptoms of delirium should be seen by a doctor right away. The good news is that delirium is treatable. When healthcare providers identify the underlying causes, whether it's an infection, dehydration, medicine changes, or something else, we can manage the symptoms, and most people do improve. Knowing how to recognize the early signs of delirium helps families and caregivers act quickly. Prevention starts with awareness, and understanding what to look for means you're better prepared to make informed decisions at critical moments. When you're familiar with these signs, you're also more likely to notice the changes in yourself, giving you the confidence to speak up and ask for help when you need it. So we want to create a culture of if you see something, say something, whether it's family, clinicians, long-term care staff, or the person themselves. Delirium can show up quickly. So having many eyes on subtle changes makes recognition possible. We encourage open communication across roles and settings. No concern is too small. Teamwork through noticing and reporting leads to prevention and better outcomes. Recognizing the signs empowers people to advocate, not just for others, but for yourself as well. So, across Ontario, there's a real push to strengthen care for older adults, especially when it comes to preventing and recognizing delirium early. And it works. When we prevent delirium or shorten how long it lasts, people feel better, recover faster, and have much better outcomes. These efforts really highlight that delirium isn't just something we expect with aging, it's something we can actively work to reduce and manage. And when we do, the difference in a person's well-being can be significant.
Thank you, Lauren, for a great introduction to why we are talking about delirium and what it is today. To build on why we're talking about delirium, delirium is surprisingly common. Up to 3 out of 4 older adults may experience delirium when they're in the hospital after a serious illness or surgery. These people might also experience delirium after they've left the hospital. So it's important to be aware about it as both an issue that might occur in a hospital setting, in a long-term setting, long-term care setting, in a retirement home, or even at home. We all work together to understand that delirium is common and we can prevent it and see the signs when it does occur to act early. One of the other reasons why we're talking about delirium and raising the awareness is that delirium is often overlooked or mistaken for something else, such as depression, just being tired, feeling fatigued, or might be mistaken for underlying cognitive changes such as dementia. One of the most frequently asked questions when we've presented on delirium in public engagement sessions has been, how do I know if it's delirium or if it's just a dementia or if it's a depression? And that is a really great question. Even for healthcare providers, this can be a tricky thing to determine at some points in time. It's also important to consider that you might have more than one condition at the same time. So it's important to know what the person's baseline is or how they are on most days before the illness. One of the main differences that we can determine whether we're looking at a delirium or an underlying cognitive impairment or depression is how the delirium shows up. Delirium shows up quickly, so the onset is quickly within hours to days, whereas with dementia, it develops slowly over months to years. You would see cognitive changes. Depression has symptoms on most days and develops gradually over time as well. So delirium, in summary, is that quick, sudden change within hours to days, how a person is changed in their behavior in a short period of time. With delirium, the symptoms can come and go over the course of the day. We call this fluctuating. So at one moment, a person might be speaking clearly and engaged and able to be alert and paying attention. And in the next moment, they may be quite confused or sleepy or withdrawn. With dementia, we would expect to see symptoms remain relatively stable over the course from one day to the next. And depression, the symptoms are present most of the time and are often worse in the morning. Lastly, with respect to the cause, delirium, the cause is often another problem in the body, such as an infection or not drinking enough water. The body likes to be, as one of our physicians here at North Simcoe Muskoka Specialized Geriatrics likes to say, the body likes to be in what we call that Goldilocks zone. Not too much of this, not too little of this, just getting to that right level. And when something throws off that balance in the body, a delirium can arise. With dementia, the cause is related to a change in the brain with brain structures. And with depression, the cause can be multiple things. It can be things like changes in life events, changes in chemical changes in the brain. So it is important to note that the causes of delirium are generally reversible. Once we treat that underlying cause, we would expect to see an improvement in the delirium. In summary, delirium starts suddenly, usually over hours to days. You will notice a difference in how the person is behaving. whereas dementia is progressive. It worsens over the course of months to years. You would not likely see a worsening in someone's dementia overnight. Regardless of what we might be looking at, any change in your brain health, whether it's feeling low mood, withdrawn, overly tired, confused, having difficulties with your memory, any change like that warrants having a discussion with your healthcare provider. And also important to note that delirium is usually reversible if we catch it early, which is why it's important that we all play a role together in detecting delirium. You may be wondering who is at risk for delirium, and there are many factors that place a person at risk, and these are some of the top risk factors. Delirium is most common in people who are 65 years of age or better, but we know that it's not exclusively an illness experienced by people over age 65. I did see people in as young as 20 have delirium when working in acute care hospitals. Delirium is also more common in individuals who have underlying difficulties with their memory or understanding, such as individuals who have dementia. And in these individuals, it's important for us to understand what their baseline is so that we can detect the changes. Delirium is also a risk factor for delirium is having had a broken hip, a significant fracture of the hip bone. Delirium is also common in people who have a serious illness that's not getting worse, or an illness that's at risk of just not getting better, continuing on. Individuals who have had delirium before are also at increased risk. They have a vulnerability to having it again. And individuals who've had a history of alcohol or substance use disorder are also at increased risk of delirium. The cause of delirium, it can be many things, and for some individuals, it might just take one illness or situation to put them at risk of delirium, such as having had a major surgery, a hip fracture, or a significant infection. And for other individuals, it may be a number of factors that build on top of one another, such as a change in medication, not getting enough sleep, becoming dehydrated. But many things can cause delirium, such as an infection in the body, a change in medications, or a stopping in medications. Also, not drinking enough water or becoming dehydrated can cause a delirium. Difficulties with fully emptying bowels or bladder can cause delirium, or other things that can put too much stress on the body and upset its balance. And again, for some individuals, it might be one of these things, and for others, it might be a number of factors working together to cause a delirium. How is delirium treated? Delirium usually gets better when we treat the underlying cause. We have to find out what that underlying cause is. So if it's an infection, the physician or nurse practitioner would find out the reason for that infection and treat it with the most appropriate medication course. If it's dehydration, the strategy would be to treat the dehydration. And that usually treats the problem, and we would expect to see an improvement in the delirium. In some situations, when the causes are multiple, we can engage both in treating the cause and providing good preventative proactive care that I will cover in a minute, and that helps provide an improvement for delirium symptoms. If you or experience delirium yourself or are supporting a person who has delirium, you may want to ask your healthcare team, how long will the delirium last? How long might it take for this person to feel better? How will we treat the delirium? How will we manage it? What else could we do in addition to treating the underlying cause with medication? What else could we be doing to support the person having a delirium? We also know that delirium is preventable. This is the good news, that through good routine care, we can help prevent delirium across all different care settings, but especially in acute care settings where people are particularly vulnerable to experiencing delirium in the hospital. Delirium can be prevented through good routine care, such as getting up regularly to use the toilet as the person is able, optimizing their language, hearing, and vision. So if a person needs translation services, helping them to make sure that they can hear both what's going on and be understood. It's also essential to have glasses and hearing aids if a person needs them in at the time of an illness. Oftentimes people will say, we don't want to take the glasses or the hearing aids to the hospital because we're worried about them getting lost. That is a very understandable concern, but we know that by not being able to hear, not being able to see properly, This makes a person much more vulnerable to delirium. Supporting a person or helping yourself at a time of an illness to eat and drink as best as you're able to. Um, in some situations, it might look like helping a person to make sure that they're able to open their containers and get access to food and beverages that they enjoy. We can also support a person to prevent delirium through getting good opportunities to get up and get moving. So if they're able to get on their own clothing, making sure that they're sitting up at the edge of the bed at the very least, or even better, sitting up in a chair to take all of their meals, getting up regularly and walking around during daytime hours is a really great way to help prevent delirium. Supporting a person to maintain their regular sleep and wake cycles and sleeping well is another essential component of preventing delirium. And this might look like making sure that the person is supported to be active during the day, getting exposure to natural daylight, and then supporting through a calm environment at night, maybe with some familiar objects from home, a pillow that a person enjoys, to support sleeping well throughout the night. We know it's also important to keep the brain stimulated in a positive way. There are certain things that overstimulate the brain, but there are things that we can do to positively stimulate the brain of the person throughout the day through keeping the person oriented to what's going on, to the date and time of year, to the seasons, and engaging in some activities that a person enjoys, such as crossword puzzles or Sudokus. For some people, it might be knitting. For some people, it might be engaging socially. Finding something that a person can enjoy to pass the time and stimulate their brain during the course of an acute illness is especially important. Another critical component is managing pain. When a person experiences pain, it's very difficult to do all of the things that have been previously mentioned. Pain is a risk factor for delirium, but it also makes it difficult to eat and drink well or get up and get moving. So if you are experiencing pain or if you're supporting somebody experiencing pain, it's essential to have that conversation with the healthcare team about what strategies could be employed to support that person reducing their risk of delirium. I'm going to pass it back over to Lauren, who's going to cover some specific things that we can do to support a person both to prevent delirium and for a person who is experiencing a delirium.
So, all the things that you can do to prevent delirium, you can also do to support someone experiencing delirium. So, we won't read through each one of these as Heather has covered them pretty well in the last slide with prevention. But I'll give you some practical things that you can do when supporting someone who is experiencing delirium in a hospital or in long-term care or even at home. So, you can hold the person you're supporting's hand or touch them if it comforts them. Delirium can be very frightening and concerning for the person who's experiencing it. So just giving them that reassurance, letting them know that you're there and that they are safe, and that you're aware of the situation and you're there to support them. That can make a world of difference for a person experiencing delirium. If you can't be there in person, you can always connect with the care team to try to phone in to talk to them, or use video conferencing in order to see them and let them know that you're there and that you're supporting them. You can remind them where they are by showing them what date is on a calendar or referencing out the window and commenting on the weather or the space that you're in. As Heather said, make sure they're using their personal items, so glasses, hearing aids, dentures. And there is always that fear that, oh, I don't want to bring those to the hospital because you don't want to lose them. But you can connect with your care team to check what's the best way to label these. Is there a place that we can keep them when they're not in use so that we don't lose them? Just having that open conversation to make sure that that person you're supporting can use all of those devices in order to stay oriented to where they are and what's going on around them. Bringing familiar items to support your person, such as photos or a favorite blanket, can help bring them comfort. Maintaining a quiet and calm environment is really helpful. And if you are the person experiencing the delirium, it's okay to ask for help. or to voice your concerns and needs. It's really important that you reach out for that help. And next slide. So, some questions that you can ask. So, if you're there supporting someone in hospital or long-term care, asking the right questions can make a big difference. Two great ones to start with are, do you have a program to check for and prevent delirium? And what can I do to help reduce my family members' risk? So these questions open the door to teamwork and early prevention. And just as important as asking these questions are, what you share with the care team is equally important. So things like past health issues, all current medications, any previous episodes of delirium, or a history of dementia or memory changes. These details give staff the full picture so they can catch risks early and tailor care to the person you're supporting. The more we speak up, ask questions, share information, the better protected our friends and family are. So, if you yourself feel like you're not acting and feeling like yourself, it's okay to ask for help. Delirium symptoms can come in waves. One minute you might feel all right, and the next you're confused or sleepy. If you don't feel right, let a trusted friend or family member know that you need help and support.
Thank you, Lauren, for the great tips. And I would like to emphasize that a number of those tips have come from people who've experienced delirium themselves, and also from people who have had experience in supporting a friend, family member who've had delirium as a caregiver. When sharing concerns about delirium, I would like you to be aware that healthcare providers should be on the lookout for delirium. There are programs in place. Local hospitals have done a lot of work around raising the awareness of staff and having systems in place to be on the lookout for delirium. It is very important to share if you've had delirium before, and even better to make sure that if you have had an episode of delirium, that this is on your healthcare record, because we know that it does increase a person's risk of having subsequent or further instances of delirium. Friends and family members or caregivers are often the first people to notice changes because they know a person best. And when a family member says to me, "This is not my mom, this is not my dad, this is not my wife," that is a red flag for me that we should be looking at delirium, because people do know the person best and they know what this person was like a couple days ago. So please, don't be afraid. Tell the healthcare team if you or your family member isn't acting like themselves. The team will check for delirium. They'll do a delirium screening process to ask some questions. And if the delirium is present, they'll start an active investigation to look for the possible causes. It is also important to note that in some situations, finding the cause can take some time, and sometimes a clear cause isn't found, which is why engaging in those routine best practice things to prevent delirium will continue in those situations. We know that providing those, helping a person sleep well, get up and get moving, get up and using the toilet, that will help resolve the delirium in cases where we don't necessarily know the underlying cause. If a person that you're supporting or even yourself shows signs of delirium at home, it is important to take action right away. We consider delirium a medical emergency. So the best course of action is to take them to a family doctor or nurse practitioner who knows the person's history. We do know that this isn't always possible. So there is the option to go to an urgent care center, or in situations where you have imminent concerns about the person's safety or that this might be a real acute illness, going to the emergency department is indicated. You can always call 811. It's a free health line, and they can give advice about the best place to go for the situation. And they can also tell you if there are urgent care centers open in your region. Delirium is a medical emergency and needs prompt, quick attention. The sooner we see the signs and get active treating it, we can prevent harm and optimize a person's well-being. Because delirium starts suddenly, usually over hours to days, we'll see a difference in how a person's feeling or behaving. And to emphasize, we did cover this, but any change in your brain health, whether it happens suddenly or not, warrants having a discussion with your healthcare provider. Delirium is usually reversible if we catch it early. And as such, we encourage you to speak up. If you see the signs that a person is at risk or experiencing delirium, please say the word. Use that word, delirium, in critical situations. Time matters. Whether you find yourself at home or at the hospital or in a retirement home, in a long-term care home, it is important that you take prompt action.
And we just wanted to take a moment too to thank caregivers. Thank you so much for all the support that you give to the person that you care for. We see you, we hear you, and really we wanted to provide a lot of this information to help you to continue that support and to advocate and to speak up when you see that there is an issue going on. And to support you, we'd like to let you know about the Ontario Caregiver Organization. They're an amazing organization that offers a lot of supports. They have a helpline that's 24 hours. If you ever need to talk or have someone to lean on, they have group and peer supports. And there's a lot of online learnings as well if you'd like to continue learning about other things to help you in your caregiving journey.
Thank you, Lauren. And I would like to echo just a huge thank you to the caregivers across our region who are out there day in, day out, supporting older adults and helping them to live to their best possible abilities. You're a critical care partner in our healthcare system, and a very big thank you. Know that we see you and we are actively working on improving supports available for you. Wanted to share a couple opportunities for further learning. If you have questions about delirium, we will be sharing the Delirium Patient Guide that is produced by Health Quality Ontario in partnership with Provincial Geriatrics Leadership Ontario. That link will be emailed to you in a follow-up from registration from this meeting. There are also great resources through the Regional Geriatric Program of Toronto that we have available in our region as well, around what you can do to prevent delirium and how to recognize it, and how to know to act when you suspect delirium, to act with urgency because we're treating it as a medical urgent concern. This webinar will be archived for later viewing on our website. The link for that for our website will be shared in the follow-up email. So this is being recorded and we'll have it available. So we encourage you to share this information with friends or families who may benefit from hearing about delirium. The more we know, the more we can work to take action together. We would like to say a very big thank you to the older adults and care partners who shared their lived experience both in supporting individuals for preventing delirium, but also for individuals who've had delirium. This really helped inform our education session and make sure that we covered the topics that people wanted to know about. I would also like to say a very big thank you to the organizations across the North Simcoe Muskoka region who are doing active work on delirium prevention. These include all of the acute care hospitals in the region. These include long-term care homes doing work to prevent and detect delirium, and also work happening in primary care and community programs. So these are family doctors' offices, family health teams, community programs such as community paramedicine, are all out there working as partners together across the healthcare system, recognizing delirium as a preventable harm that we can work together to prevent and treat early. Would also like to thank Provincial Leadership in Geriatrics of Ontario and Health Quality Ontario for the excellent quality resources that they've produced in plain language, making them available to the public. In summary, if you see the signs of delirium, please join us as the healthcare team to say the word delirium. We thank you for joining us to take action together. Share this information widely with your family and friends. And we encourage you to think about having a plan to share your risk factors, especially if you have had delirium before, with your healthcare team. You know yourself and the people you support best. Please speak up if something doesn't seem right to you. A very big thank you to joining us today for World Delirium Awareness Day. Appreciate your time this morning, and thank you to care partners and older adults across the North Simcoe Muskoka Specialized Geriatric Services region. It is a pleasure to serve you and work alongside you, and thank you for working together to improve the care of older adults.